Today's guest studied microbiology at the University of Alabama. He then attended the University of Goettingen in the former West Germany, where he graduated in 1989. For almost a decade after that, he practiced dentistry on the Mediterranean island of Cyprus, where he trained in homeopathy, completely abandoned the use of mercury fillings, and continued his knowledge on the aspects of biological therapy. In 1998, he moved to California, where he continues his practice in his state-of-the-art dentist facility. Please welcome today's guest, Dr. Joseph Sarkissian. Did I say your name right?
Yes, perfect.
Okay,
Thank
good.
you. Thank you for inviting me.
I am so excited. I've interviewed a lot of people, and today I was just so excited. I'm all about holistic health. I'm a holistic health practitioner, and I think that this is an area that is still under hush-hush, and there's a lot of controversy, and a lot of people don't even know what a biological or holistic dentist is. So would you tell us what that actually means?
That's interesting because, everyone who asks me what you do, I tell them I'm a dentist, and they say, are you a general dentist? And I say, no, well, I am, but I'm also a biological or a holistic dental office. And then they say, what's a holistic dentist? What do you do differently? And you don't give shots or you don't give medication. And it's kind of a complicated area because we are general dentists, but we try to involve naturopathic principles in our approach to dentistry. Mm-hmm. We're open to a lot of holistic methods,
right.
But it's a big field. I mean, holistic dentistry really is just not only being metal-free or not only doing one thing or another. People can go into acupuncture or use naturopathic remedies, homeopathic remedies, and but the whole thing started with a mercury issue, really, about like 2 or 3 decades ago. Mm-hmm. The amalgam controversy. Most holistic dentists abandoned the use of amalgam, and the big thing about that is that they take precautions in taking it out of the mouth.
Because that's a big deal. I mean, it seems like a lot of people are starting to, if they do have it, they're wanting to remove it, but that's a process in itself, is
of course.
Moving it properly.
You have to consider that amalgam is a very unstable alloy, and if you rub it or if you chew on it, you're releasing more mercury vapor.
Wow.
So it's not really a stable alloy, but 150 years ago, it was the only cheap material that they could use to stuff teeth with. And but now we have like excellent materials that are metal-free.
Well, that's what I was going to say. So what is used instead now?
Well, for smaller cavities, we use composites, the white resin, which are very advanced now, and they're almost like porcelain. Or for larger ones, we just use ceramic, porcelain crowns or onlays or inlays. And with 3D dentistry, digital dentistry, now we can actually have same-day crowns and onlays made. We just scan the tooth and it's milled right there in the office, and it's amazing. Glazed, and you have full control over everything.
Yeah.
And they're all biocompatible.
That's what I want to get into, because I think that's the thing that's most fascinating to me, is I think the connection between what happens in your mouth and physically what happens to your body. And that's actually how I stumbled upon you. Is I'm constantly doing research, and I have 4 root canals. Yeah. And I was doing research for myself about, health. What can I do to empower myself? I've changed my diet. I've done all these things, and I've gone through this for over a decade. And I remember reading about the connection of root canals and the meridians in the body. And I stumbled upon, I think it was the Weston Price. Is that his name?
Yes.
And it seems like the literature that he wrote from the 1920s, he actually spoke of this, but for some reason, it's still being practiced. And from what I've read, essentially, it's like having taxidermy. So even if there's no physical abscess or symptoms, the bacteria can still be leaking in, possibly creating, health issues.
The root canal issue is another big controversy.
So you don't practice root canal? Do you practice root canals?
No, but there's this thing about, there are a lot of dead teeth around, and people just have their teeth die, and or they may have root canals. But the controversy is all about the dead tooth.
Right.
It's not about the material that you use for the root canal. It's about the dead tooth. So it's the only area in medicine where you still keep your dead part of your body in your mouth. And meridian connections, they have, especially the European naturopathic doctors have established a very intricate meridian connection to a lot of different organs. So, but it doesn't mean that if you have one particular root canal, that particular organ is going to suffer, or you're going to get cancer, or you're going to get a disease. It's multifactorial. So it may make your system weaker, and eventually it'll take over. So there's a lot of stuff that goes. Your diet and your lifestyle, your stress, environmental toxins. So the root canal may just be the ultimate, threshold in bringing you over into, disease, a disease state. And these are all chronic degenerative disorders, like, autoimmune disease, diabetes, and cancer.
There are cancer links, though, right? I mean, I think I read some studies about 95% of terminal cancer patients have had root canals.
Yes, that's a correlation. Yeah, that's a correlation.
Yeah.
But again, having the root canal is already too late for the tooth. So, but also when you suffer the consequences of bad health and then you get cancer, it doesn't mean that taking out all your root canals is going to cure you.
Right.
So the best thing to do is really to avoid the root canal and to start early with dentistry, and to go through minimally invasive procedures rather than drilling and filling and packing the teeth with harmful substances that eventually crack them, and then the cascade of the tooth breaking up, turning into a root canal, getting a crown, and then extracting and an implant. It's just like this whole cascade of destructions.
Yeah. And that's why I wanted to have you on, was to hopefully avoid, help other people, because I wasn't educated at the time. So here I am now, and whether it impacted my health or not, I don't know. But I want people to know that there are other options. So let's say you were to come in and the tooth is dead, or what is the other option other than having a root canal?
There's a misconception that people who want to avoid a root canal, they may leave a dead tooth in their body just because they don't want the root canal. But that's totally bad for your system because it's gangrene. So you have to do something.
And wouldn't it hurt? I would imagine.
A lot of them don't, because the body just tries to isolate it, but then it's eating away at your bone. So you have this hole in your bone coming from that gangrenous tooth. And a lot of people don't do anything because they've heard bad things about root canals. But this is actually worse. So you have to do something.
Right.
It's your choice, really. The patient's choice is to either extract the tooth or to have it root canaled. You can't do nothing.
And if somebody were to come to you, you extract the tooth, right?
I would prefer to, but our code of ethics doesn't allow us to tell them that you have to extract the tooth.
Right.
So I give them all the information and I educate them, and they make the choice.
Yeah.
If they choose that they want to save the tooth, fine. Now and then I may perform a root canal, but when I do, I use lasers and I use ozone. I tell them it's not the best thing, and they may still lose it in the future, or I just send them to a specialist.
And can you explain that? How do you use the lasers and ozone?
Well, the laser is actually energy pulses in the root canal system that kill a lot more bacteria than just irrigating with an antiseptic. On top of that,
could be an issue too, of just making sure it's all. Which I've heard it's almost impossible.
It is, yeah.
Yeah.
It's just kind of a little more,
efficient.
disinfection.
Yeah.
Because the new laser tips, I use the BioLase from. It's a water lase unit from BioLase, which has a long tip, just looks like a file, and it fires sideways on the walls of the canal, and it just obliterates, any dead cells, bacteria, and just opens up those pores. Because the dentin the root canal system is made up of millions of tubules,
Right.
which were once filled with live cell projections. And those are the ones that die, and you can't get to them.
Yeah.
So at least you're kind of firing a laser into those tubules. And then after that, you just kind of inject ozone gas in the whole system, and that'll immediately kill a lot more bacteria.
And I also saw, I mean, I love some of the things that you do, and I love your share on Instagram and YouTube. Because when else do you get to go into, as a normal person, to be able to look into a dental office and see actually what you do? I love what you do with, when you do extract a tooth, I don't know what that is. It almost looks like a stem cell, some kind of something you put back in there for it to heal more properly or something?
It's called PRF, a platelet-rich fibrin.
Okay.
And a lot of you have probably heard about PRP.
Yeah, I've done PRP facial, so that's why I was like, oh, that's so
it's just
cool.
another version of PRP, which actually sets to a more gelatinous mass, and then you can compress that to membranes. You can mix that up with grafts and insert it in, sockets or place it over bone so that you form like higher quality bone before we put a metal-free implant.
And that's zirconia?
Zirconia, yeah.
Zirconia.
Which is like zirconium dioxide, which is zirconia. And it's a ceramic. And over the past 15 years, they started from Europe, and now they're FDA approved. They're amazing. I mean, they're pure ceramic and biocompatible. As you know, metals have galvanic currents, and
because normally people would get implants with a metal. Okay.
Titanium mostly.
Yeah.
And which there are millions of titanium implants all over the population, and but more and more people want metal-free inserts in their bodies, basically.
And it seems like Europe is way more advanced when it comes to holistic health. And do you feel like, it sounds like when you went to school at Goettingen, that's kind of when you transitioned more into the holistic.
Well, first of all, Europe, and especially Germany, because as you know, homeopathy started in Germany. Hahnemann was German, and they're more open to holistic methods. I remember I was a student and I wasn't in holistic medicine. I just went to a doctor and I was sick, and he prescribed me some nasal decongestants and just some medication, and then he prescribed me echinacea and some other tablets that were all herbal based, and these were all like proper pills that were made, which are also being used by doctors.
Right.
They're open to it.
Yeah.
Over here, it's a little harder because they're not regulated as much.
Yeah.
But they're more open. So when you get the awareness in the consumer that they want to be metal free, then it's easier in Europe to satisfy that population and to perform these scientific studies and to develop this technology than here.
Yeah, I understand.
There's more red tape here.
Yeah, I understand that, and entirely, not just dentistry, but in medical practice in general. So do you use homeopathy? Do you recommend patients take a certain homeopathic remedy prior to a surgery or post or anything like that?
Homeopathy is amazing. It's the principle of very high dilutions of a substance, and very ironically, the better homeopathic remedies are made from strong toxins or poisons.
Right. Because it's like cures like, right?
Exactly. Yeah. The law of similars, whereas mainstream pharmacological, drugs are based on the contraries. So you're trying to suppress a symptom. You're going against it. And that's why there are so many side effects to those drugs. But homeopathy just helps the body overcome something. For example, if you get stung by a bee, you get a swelling and itching and burning, right? So if you have a disease that has that particular symptom, like a swelling, like your face is swollen, and it's not pus, of course, but it's like a bee sting. It's a swelling that looks like a bee sting, and you take the bee remedy, then that'll cure you.
It's like pulsita or something, I think.
Apis.
Yeah. Apis. Yeah.
And there's a lot more. Even mercury has a remedy.
Wow.
A lot of times when we take mercury out, I give a dose of mercury
Wow.
afterwards.
That's amazing.
Yeah.
And there's no negative side effect. It either works or it doesn't work. Is that right?
Exactly. Yeah. My daughter once swallowed a whole bottle of those pills, and
because they taste good. My
yeah,
son's always
they're
like, they're like
sugar-based.
sugar.
Yeah.
Yeah. I know what you mean. And speaking of kids, what kind of biological dentistry do we use in like orthodontists or, for orthodontics or retainers? I mean, everything is metal. How does that work with biological?
I'm glad you brought it up because kids are really, dentistry on kids will either make it or break it in their future.
Yeah.
Because it's so important. They're growing up, and they most of the time they don't know what to expect. And first of all, you have to approach them, and that's a very holistic approach. You have to approach them in a very honest way, and consider everything that you're doing on them has consequences.
Right.
Including the fear and how you give them the shot or how you prepare them. So that's a big integral part of preparing kids. And kids can't have a say in what they're getting in their mouth. And
that's true.
As far as adults, I don't really care if you want a mouthful of amalgam in your mouth, but
it's your decision.
if there's any doubt that amalgam is maybe bad for your system,
and that's mercury.
Don't let them put it in your children.
Right.
You can suck on it all I care,
Yeah.
But and a lot of dentists really, just to make a point, they say, oh, I'm probably putting them in my kids, just to make a point. I say, okay, why don't you just put it in your mouth, but leave your kids alone, because even if there's a slight doubt that this thing is toxic,
right,
then you're doing them great harm. But then with kids, it's also the orthopedics,
right,
how they're growing and how they're breathing and how their facial jawbone is
growing
developing.
and stuff, yeah.
So you have to see those signs and symptoms of when to intervene, and it's usually the time when they're growing at a fast rate, which is between 6 and 11. If you start braces at 12, that's already too late. So you may end up losing permanent teeth, and that's a disaster, because extraction orthodontics, it pulls 4 healthy teeth, and what they do is they just kind of push all the teeth together. They look straight, but the jaws are the size of a jaw of a 6-year-old.
So you mean they extract the teeth because there's not enough space?
Correct.
For the teeth they have,
Yeah.
because their jaw is not wide enough, or
Yeah,
their
there's
mouth
not
is not wide
exactly.
enough. Right. Yeah. Okay.
And so when you start early and when you see these signs, then you can start jaw orthopedic therapy with special appliances that grow bone. So you're actually making the jaws bigger.
Retainers?
So you can call them retainers, but they're jaw orthopedic appliances,
Oh,
or
okay.
arch development appliances, and they're all removable in
Yeah.
that stage. And it gives you a huge advantage, because now all the teeth coming in have more room. So you don't have to extract those teeth, and you can put braces on, and in a year you're done. Because, when you see people who have extraction braces and they're missing those 4 teeth, and they hit 40, they're going to be suffering from something. Something has to give. It's either they have sleep apnea because their jaws are very small, their tongue has no room,
Interesting.
so they suffer from obstructive sleep apnea, which they don't know about. Or they have TMJ trouble, or they just have relapse because the teeth are just not, properly aligned. They're just pushed together in a very unnatural way. So I always see problems in these people.
Wow, it's so interesting too. Like, I don't think people make that connection. That's what I want to get through today, is that, what happens in your mouth actually can affect the rest of your body. And I feel like a regular dentist. Do they teach this in dental school? Do they talk about that, or is it very much just, here's the problem, let's fix it, and it's almost like the mouth is separate from the rest of the body? I mean, I don't know. It seems like your education was much different.
It was, but I mean, you learn a lot in dental school, and they're just rushing to teach as much as possible in those 4 years. Of course, in Germany we had 5 years, but we don't have the undergrad program. So the approach in dentistry has to be, I mean, there's no way you can teach everyone everything. I mean,
Right.
after you graduate, I wasn't mercury free when I was in dental school because the 80s was really, amalgam was big, you know, and we learned how to place amalgams. A year later, I was in Cyprus and I met this toxicologist, and he had come back from England, and he said, do you put amalgams? And I said, yeah. I just repeated, you know, like a parrot, what they had told us, like, oh, there's no sufficient evidence that mercury is released in sufficient quantities to cause any harmful side effects, and that kind of. So he gave me a few books, you know, the Hal Huggins book, and a lot more research that I read, and I was like immediately taken by it, and said, this is a lot more logical.
Yeah.
It makes more sense because mercury is really one of the most toxic substances on Earth, and it's not supposed to be in your mouth, and any type of mercury alloy is not a stable alloy. And don't forget that mercury has a double charge, right? So a lot of our minerals that we have as salts are also double charged, like calcium. It's a 2+ charge, and so all our enzymes and our bone and all our hormones work on these charged minerals. So what mercury does is it just kind of takes over these charges, and it just gets stuck there, and you can't release it.
Wow.
The half-life of mercury in the brain is about 28 years, which means if you have 2 pounds of mercury, well, let's say 2 milligrams of mercury in your brain, 28 years later, you're just going to get 1 gram, provided you don't get more mercury.
Wow.
But we're also always absorbing more and more mercury, not only mercury, but lead and you know, all those
Aluminum
other
and-
pollutants.
yeah.
So
We only have control over what we have control over, but we do have control over, as long as we're educated, you know, what we put in our mouth. And I wanted to ask you, like, so just for the general public, like, can you tell us some things of like what we may not know? Like, so now we're educated on mercury, a little bit more educated on root canals, orthodontics with children. What else is there a connection with biological dentistry that other people may not know?
Again, it's the big picture.
Yeah.
I think prevention is very important. Proper diet, and Weston Price talked about proper diet, and
Right.
a lot of people ask me, what do you eat? What's the best thing to eat, you know, to avoid dental trouble? And just go back 10,000 years and just kind of...
Sugar, right?
Yeah, there's no sugar, and people eat whatever is in season and whatever they can catch or whatever they can grow. And they don't mix foods like we do here. We have so much of an abundance here that from everywhere around the world, you know, and we're just like eating things from South America and Asia, and here you have to eat local produce,
agree.
and you have to eat simple. Just follow your normal dietary guidelines, you know, common sense, not what's in fashion at that
Right.
moment.
And how do you feel about fluoride?
Fluoride is a cell poison. Very tiny amounts of it will harden your teeth, but there's so much fluoride around that it may actually cause more harm.
So do you use fluoride toothpaste or no?
No.
No.
No. If you have proper oral hygiene, if you're flossing and brushing correctly, you don't need fluoride, because all the fluoride that naturally comes out of your saliva is going to recalcify your teeth. And fluoride treatments on little kids with those trays that have like these fluoride gels with 3 to 4%,
It's toxic.
and then you're like putting it with a tray on the teeth, and of course it's going to harden the teeth, but you're absorbing that through the mucous membranes. It's spiking in your blood.
Yeah.
And there's a lot of research on fluoride, which I'm not going to...
It even says, I tell this to people, if you look at the toothpaste, I forgot what percentage, but it says, poison control. You swallow it.
Yeah, yeah.
So,
yeah.
right then and there, that says enough.
Yeah, those are the double standards of our
Yeah.
our professions.
Yeah.
Because there's also that with mercury. When you have scrap mercury
Yeah.
or amalgam that you're left with,
Yeah.
you're not supposed to discard it in the trash. You have to you have to put it in tightly sealed containers and underwater.
Yeah.
And
Oh, wow.
then you have to send it to a particular recycling center.
But you just put it in someone's
Exactly.
mouth. Yeah.
It's okay if it's in your mouth, you can, which is even more corrosive than the environment.
Yeah.
And your, temperature-wise, acids and every sort of thing you can imagine.
Yeah.
But you can't put it in the environment. That's a big issue now,
Yeah.
though. It's coming into the environment more.
Yeah. I think what I want to leave people with is to educate themselves and find out as much knowledge as they can. And I love that you share so many videos, like I said, on your Instagram and YouTube, where they can watch all your videos and learn, see what's going on with them. If prevention, obviously, but if they already have some issues, weigh their options. But I always like to ask all of my guests, and it can have to do with dentistry or not, but what is your golden secret?
Well, I have a motto that I really love is only dead fish swim with the current. So you just have to always question things and use your common sense and educate yourself and acknowledge the fact that you don't know everything. And even if you think you know a lot, you still don't know a lot. And you just have to keep an open mind and don't do harm, which is the main principle of medicine that the father of medicine, Hippocrates,
Yes.
said, don't do harm when you're performing medicine or dentistry. And just educate yourself.
Yeah, I love that. Thank you so much for being here today.
Thank you for inviting me.
Sharing all your knowledge. Yes,
It
thank
was
you.
fun.